Hi everyone. Thank you for joining me today. Let's get right to it. I am Morgan Nelson and I am doing this health education video to help educate people on why to stop smoking and how to stop smoking. We're just gonna talk about the risks and how to stop and all that today. So, we're going to start by discussing why making a health behavior change is important. Making a health behavior change can be very helpful to your overall physical and mental health. It can be very difficult to make a health behavior change because you and your body are so conditioned and used to being used to something. So when you try to change a habit, sometimes your body doesn't know or isn't sure how to react. So it can be very hard to break that routine or that cycle that you and your body are used to. So when you do something every single day, then you and your body get kind of conditioned to do that thing every single day. So it is also very important to make a health behavior change when you are doing something that could possibly be detrimental to your overall health, your mental, your physical, your social, your emotional health, all of it. Because it can put you and your body at a high risk for many diseases and even stress. So, today I am going to be talking about the health behavior topic, quitting smoking. Smoking can sometimes be a very controversial topic because everybody has different opinions on smoking. But the one thing that everybody knows, whether they smoke or not, is that smoking is not good for your overall health. So I am here today to help you and to guide you with why and how to stop smoking. So if you have any questions throughout this session, please feel free to stop me and ask me. This session is going to consist of me educating you on the risks of smoking and also some strategies to help you quit. So we are going to start by talking about some health risks due to smoking. There are many health risks that are caused by smoking. So the first is increased risk for cardiovascular or heart disease. The increased risk for heart disease is a huge risk factor that results from smoking. Some heart diseases are strokes. Increased risk of strokes increases with smoking. The more you smoke, the more likely you are to have a stroke. When you have a stroke, you are twice as likely to die from it if you are a smoker. So, for example, if you smoke 20 cigarettes a day, you are 6 times more likely to have a stroke than a non-smoker. 6 times more likely. And about 25% of all strokes are related to smoking. So about 1 in every 4 strokes is caused by smoking. The next heart disease is coronary heart disease. It's another risk factor of smoking. It results from the formation of plaque buildup in blood vessels, and smoking increases your chance of that. Secondhand smoke alone causes almost 34,000 deaths every year from coronary heart disease. Smoking also increases blood pressure, which results in coronary heart disease. If you stop smoking, it reduces the risk for heart disease, the risk of a heart attack, and death from heart disease by almost half. Almost 30% of all coronary heart diseases, almost 30% of all coronary heart disease deaths each year are due to smoking. Smoking puts the heart at a lot of risks. Another cardiovascular disease that is a risk of smoking is damaged blood vessels. They thicken and become more narrow, which leads to blood clots. The chemicals that are in cigarettes cause the little cells that line the blood vessels to become bigger and inflamed. If you stop smoking, the damage done already to your arteries can be reversed in most cases. Once you stop smoking, the blood circulation improves within like 2 to 12 weeks from stopping smoking. So honestly, pretty quickly. It also results in physical activities being easier to do, and it lowers the risk of a heart attack. The nicotine and carbon monoxide in cigarettes make it more difficult for your veins to work properly. Smoking causes the blood vessels in your body to constrict, which reduces the amount of blood that can flow to the rest of your bodies and organs. Veins that are damaged from smoke make it harder for blood to flow through them. Next is smoking puts you at an increased risk for respiratory diseases, such as COPD, emphysema, chronic bronchitis. Smoking is the leading cause of COPD. Smoking damages the air sacs and airways and the lining of your lungs, which makes it harder for air to move in and out, which ultimately makes it harder to breathe. Secondhand smoke can also cause COPD, not just firsthand smoking. Smoking is also the leading cause of emphysema. Emphysema is one of the most preventable types of respiratory disease, yet it's so common within the smoking population. Stopping smoking can slow the progression of COPD and emphysema. Smoking is also the number one risk factor for developing chronic bronchitis. Studies have shown that over 40% of smokers develop chronic bronchitis. The best way to prevent it is to not smoke or to stop smoking. Lung cancer. Lung cancer is a huge concern when it comes to smoking. Smoking is the number one factor of lung cancer, and smoking is linked to 80 to 90% of all lung cancer deaths. Smoking can lead to many other cancers as well, such as bladder, blood, cervix, colon, esophagus, kidney, liver, throat, stomach, pancreas, and also lung. Smoking increases the risk of cancer significantly. Smoking can lead to death. Smoking causes nearly 1 in 5 deaths in the U.S. per year. Smoking affects mental health in many ways. It increases anxiety and tension. Some people think that smoking helps calm them and relax them, but actually, in the long term, it increases the anxiety and tension. Nicotine initially relaxes you, but the feeling is only temporary and eventually gives you withdrawal symptoms and cravings, which increases anxiety. Smoking increases cravings and causes withdrawal symptoms. Smoking is addictive, so once your body gets used to it, like we talked about earlier, once your body gets used to something, your body craves it, your body needs it, and when it doesn't get it, your body withdraws from it. Smoking can affect those with depression. Smoking actually releases dopamine, which causes the brain to stop making the dopamine, so it increases the urge to smoke more. People with depression have a harder time quitting, and the withdrawal is more severe. People with schizophrenia are 3 times more likely to smoke. And a little fun fact, studies are actually being done to link smoking to increasing the risk of developing schizophrenia. Smoking and addiction go hand in hand. Nicotine is easily addictive. It is a chemical that makes it very hard to stop. Nicotine creates this pleasing effect in the brain, but it doesn't last long, which makes people go out and grab another cigarette, and then it creates the routine of your body craving it. The more often you smoke, the more nicotine you need to feel good. When people are trying to quit smoking, withdrawal occurs. There are many treatments available to help you stop smoking. Certain situations trigger the need to smoke, such as breaks at work or school, talking on the phone, drinking alcohol, driving, social gatherings, even drinking coffee. Stressful situations can also be triggers. So now we are going to discuss some strategies to help you stop smoking. The very first step is to find the reason why you want to stop smoking. That will help you stay strong in wanting to stop. Having a reason to quit is huge because it gives you a reason to fight the urge, and your reason should be more important than wanting to smoke. You need to mentally prepare before you just stop cold turkey, because smoking is an addiction, so it is a lot more difficult to quit than just saying, oh, I'm going to quit, and then throwing out cigarettes. You need to prepare to have withdrawal symptoms. There are a ton of resources to help you stop smoking, such as apps, groups, support groups, therapy, counseling, medications. Some people even use methods such as acupuncture, hypnosis, chiropractor. There are a few nicotine replacements that can help you quit as well. There's gum, there's lozenges, there's also patches that can help improve your withdrawal symptoms, which actually makes you more likely to succeed in quitting. There are certain prescription medications that help you kick the cravings and make cigarettes not as desirable. And they also ease the withdrawal symptoms. The next step is having people around you that are supportive of you and are there for you to lean on in your journey to quitting. Let the people around you love know that you're trying to stop smoking, and let them encourage and help you stay on track. There is also support groups and counselors that can help you through it as well. The next step is to make time for yourself. Many people turn to smoking because they're stressed or they need to relax. So once you quit, you need to find other ways to help you stay calm and relax. Self-care is huge. Some people use exercise, music, friends, massages, anything that'll help you out. Even finding a new hobby that you enjoy can be therapeutic. The next thing is to avoid triggers. Alcohol and stress can be huge triggers for smoking. When you drink alcohol, it makes you want to smoke. So if you're trying to quit, you may want to avoid alcohol until you are no longer tempted to smoke. Find other things to do during the times that you want to smoke. The next step is, once you stop smoking, clean your house and all your belongings to get rid of the smoke smell and things that remind you of smoking. If the scent is always around, it's going to tempt you. You don't want to see or smell anything that can be a trigger for wanting to smoke. The next step is to keep trying. Don't give up. Most people have to try to stop several times before actually succeeding. Smoking is very addictive, so it's not easy to quit. If you slip up and smoke when you're trying to stop, be easy on yourself and don't get discouraged. Just keep trying. And the very last step is to get exercise. Being active and having an active lifestyle can curb nicotine cravings and help lessen withdrawal symptoms. When you feel the urge to smoke, get moving, go for a walk your dog, get out in the yard, whatever you want. So just remember that making a behavior change is important no matter what it is. But to stop smoking is huge. It lowers your risk for all types of things, your overall mental and physical health. So if you have any questions or need some resources to reach out to help you in your journey to stop smoking, just let me know. Thank you for joining me today.